When you've met one autistic person, you've met one autistic person. This phrase is often heard, but what does it truly mean? Autism is often misunderstood. For some, it's a disability needing treatment. For others, it's just a different way of being. So what is autism really? Should we focus on treating it or accepting it? In this video, we'll explore how doctors see autism compared to how autistic people see it. We won't cover everything, but we'll give you a lead into the rabbit hole of understanding autism. Before diving into how autistic people experience life, we need to first look at how autism is diagnosed and categorized by medical professionals. Will these clinical definitions tell us the whole story? Let's find out. From a clinical perspective, autism is a developmental disorder, and a person with autism might be very attached to their routines or favorite activities, find it hard to change from one activity to another, have difficulty with social skills, like making friends or reading body language, be sensitive to sounds, lights, or textures, which might cause discomfort. In the US, mental health care professionals rely on the DSM-5 document to diagnose their patients. DSM-5 categorizes autism into 3 levels based on how much support a person needs. Level 1 autism requires little to no support, Level 2 autism requires more support, and Level 3 autism requires a lot of support. To understand each level, imagine 3 people with autism, one with Level 1 autism, one with Level 2, and one with Level 3. They are focused on some activity and are asked individually to move to another activity. How would each of them respond? A person with Level 1 autism might resist the change initially, become frustrated, or ask for more time to finish. However, with some reminders or encouragement, they can usually switch tasks after a short delay. A person with Level 2 autism is likely to show stronger resistance to changing activities, might express frustration or anxiety more openly. Transitioning will likely require more support, like clear instructions or visual aids to help them move from one task to another. A person with Level 3 autism may react very strongly to a request to change activities. They might refuse altogether, become upset, or have a meltdown if forced to switch. They will likely need significant help or calming strategies to manage the transition. Sounds solid enough, right? But these levels don't always tell the full story. Many autistic people say the autism level system doesn't always show the full picture. For example, someone who usually needs less support might actually need a lot more support on some days or in different situations. This means the levels might not always reflect how much help someone really needs, which can change depending on the day or what's going on. DSM-5 is not the only document used to diagnose autism. Healthcare professionals in Europe mainly refer to the ICD-10, developed by the World Health Organization. We won't go into too much detail, but the diagnostic criteria for ICD-10 doesn't involve levels. It uses a different approach to categorize autism. You can do your own research if you're interested. While clinicians focus on what they see as deficits, many autistic people see their differences as just a part of who they are. For example, where people might see a lack of eye contact as rude, autistic people might avoid eye contact to focus better on the conversation. Their direct communication can also be misunderstood as being blunt or insensitive. But for them, it's simply being honest. Sometimes, because of the differences in communication or reactions, autistic people may be assumed to lack empathy, when in reality, they just have a different way of expressing it. We suggest checking the double empathy theory to understand this better. An autistic person can focus intensely on one thing. This can help them become very skilled in specific areas, but it might also make it harder for them to switch between different activities or handle distractions. Another theory that can bring more insight to this is monotropism. It was introduced by Dina Murray, Wen Lawson, and Mike Lesser, 3 autistic researchers. They developed the concept to help explain the intense focus and single-mindedness often observed in neurodivergence, which includes autism. Someone who is autistic will sense and feel the world differently to an allistic person. Things that may not bother someone who is allistic may greatly agitate someone who is autistic, and vice versa. To clarify, allistic just refers to someone without autism. Autism masking is very common in level 1 autistic people. They feel pressured to mask their behaviors to fit into the society. This masking, where they hide their natural reactions and force themselves to appear normal, can be exhausting and lead to depression or anxiety. People who mask often go undiagnosed for years because they become so good at hiding their true selves, especially women. To many autistic people, autism is not something to be fixed, but rather a different way of thinking and experiencing the world. They would prefer to be accepted rather than forced to fit into the society. So how do we build a world where all kinds of minds are accepted? Neurodiversity is a term that started in the 1990s. It was used to help people understand and respect those with autism, ADHD, and learning differences like dyslexia. Neurodiversity is the idea that differences in the brain function, including autism, are natural variations of human thinking. Instead of trying to cure or change autistic individuals, the neurodiversity movement advocates for creating a world that accommodates everyone. Autism is complex, but at its heart, it's about differences in how people experience the world. Autism isn't a one-size-fits-all. By listening to autistic voices and understanding the full spectrum, we can create more inclusive environments. However, no one autistic person can speak for the entire spectrum, because it's incredibly diverse. By exploring this rabbit hole, you're just beginning to understand the many layers of autism. There's still so much more to learn, so I encourage you to keep diving deeper and check out other perspectives. What do you think? We'd love to hear your thoughts on how we can better support and understand autism. Was there anything you felt was missing or could have been explained more clearly? Share your ideas and feedback in the comments. We hope to see you in the next video.